Welcome once again. The Lagos State Ministry of Health has recorded 401 suspected cases of cholera in 29 wards across multiple local governments. There are at least 21 persons confirmed dead in Lagos State.
In its recent reports, the Nigeria Center for Disease Control and Prevention said that from the 1st of January to 11th of June 2024, there have been over 1,141 suspected and over 65 confirmed cases of cholera, resulting in over 30 deaths from 96 local government areas in 30 states in the country. In Nigeria, cholera is an endemic and seasonal disease, occurring annually, mostly during the rainy season, and more frequently in areas with poor sanitation. This morning, we're joined by the Senior Special Assistant to the Governor of Lagos State on Health, Dr. Oluwatoni Adeyemi. Good morning, and thank you for joining us.
Good morning. Thank you for having me.
All right, cholera has become a mainstream conversation in the past few days or week. Is this something to be should we be very worried?
Well, I would not say we should be very worried, but it's just that precautionary measures have to be taken. We have to take our sanitation measures very important now. So all the preventive measures we have come up with as a state, as the Ministry of Health, all these have been circulated widely, and there are things that people should, your hygiene measures now should be heightened. You should take your hand hygiene very seriously, food hygiene, environmental hygiene. So it's just a time to improve on our sanitation practices generally.
What is the current rate of infection? How bad is it currently across Lagos? And are there certain areas that are of concern?
Oh, yeah. So from the time the outbreak was detected, we've had over 400 cases now in Lagos, spread across various local government areas. No suspected cases. So out of this, about 35 of them are confirmed cases. And what we mean by confirmed cases means there have been laboratory testing, and we have been able to isolate Vibrio cholera, which is the bacteria responsible for cholera, in the stool specimen. So they're like 35. So it's like less than 10% of our suspected cases have actually found to be confirmed. When we drew our epidemic curve, it was found out that most of these cases actually occurred in Lagos Island local government, and then we had some in Koshofe local government area as well. That's where we have had the highest number of cases so far. But as of today, it's actually spread across various local governments in Lagos State.
All right. So what would you say are the things that people should look out for? At what point should people start getting concerned if a person is feeling symptoms? Because we know that the most commonly abused sickness in Nigeria, I think, it's malaria. Any small thing, I have headache or I have malaria. So what are the symptoms people should look out for and know that, okay, I should be concerned, and at what point should they go to the hospital?
Okay, so usually when there's an outbreak, we usually come up with case definitions. And so currently, the case definition for cholera can be divided into two. We have the suspected case and then a confirmed case. So the suspected case is anybody above the age of 5 years of age who presents with signs of dehydration, of severe dehydration, following acute watery diarrhea. But because we have an outbreak right now, we are capturing everybody that has diarrhea right now, with or without vomiting. Although the classical symptoms of cholera are profuse diarrhea. We usually call it the rice water stool, because when it comes out, it's uncontrollable and it looks cloudy like rice water. But we're not waiting for you to have such a classic presentation of cholera. Instead, because we're doing an active case search, anybody at all that has diarrhea above 5 years, because lower than 5 years of age, diarrhea is common in children at that age from various causes. So we'll include them, but specifically anybody above the age of 5 right now, especially in our hot areas like Lagos Island, Koshofe, that comes up with severe dehydration from diarrheal causes. And some of the signs and symptoms of severe dehydration, the person is extremely weak. You have uncontrollable diarrhea, like the rice water stool I explained. And then it also affects the heart rate. It affects the blood pressure. Blood pressure reduces. Heart rate goes up. Your skin is very dry. Mouth is very dry. So the person is acutely ill.
Always thirsty, maybe.
Excessive thirst.
I just want to also quickly clarify the severe diarrhea bit, because typically when you hear diarrhea, you're already thinking watery stool. But someone may have watery stool once. Does that qualify as diarrhea? How regularly should they have experienced it before they run to the hospital or before they classify it as suspected case of cholera?
Okay, so diarrhea basically is the passage of loose watery stool, and we use the frequency to determine that. So usually the frequency, once it's more than 3 times in a day and it's loose watery stool, that can be classified as diarrhea. Of course, some people eat something sometimes that makes them purge,
Exactly.
but then when you're not having loose frequent stool up to like more than 3 times a day, and then you're already having signs of dehydration, tiredness, weakness, you're already having your lips are getting dry, you're getting thirsty, even your skin is losing its elasticity. There's loss of skin toggle, that's what we call it. So those are signs that dehydration has set in. But then, and one thing that people should know, viewers should know, is that you should have this period, you should have the ORS solution, that's the oral rehydration sachet at home. That's the first aid measure. So whether or not it's suspected cholera, it's regular diarrhea, your own part is to start rehydrating immediately after, because cholera is very acute. A lot of people that come up with cholera, they just have a short window period where they lose all their electrolytes, and it eventually becomes fatal if they don't get to the health center on time. But that ORS is a life-saving home remedy that you can quickly start using before you present at the healthcare facility.
You mentioned 401 suspected cases,
Yes.
35 confirmed. When you say, what do you mean by a suspected case?
Okay, so suspected cases are those that fit the case definition, which I defined earlier on. So we're doing an active case search. We have disease surveillance notification officers in all the local government areas. So what they do is they go around, and we also have community informants. They let them know this case definition, that is there anybody that has diarrhea here? And we're also informing the public, if you have diarrhea, present so that it can be counted as a suspected case and one which should be tested. So all the ones that they have been able to isolate, especially in the health facilities, those are the ones that have signs of probably dehydration. They are the ones that are being line listed and counted as suspected cases of cholera, because there's an outbreak and we are looking out for those that have severe diarrhea.
Now, what I'm trying to clarify, if you have 35 confirmed cases, 401 suspected, does it mean that all 401 have been tested and only 35 showed?
Okay, so we have
positive.
401, well, it's even more than, slightly more than that now, but on average, 401 suspected cases. Out of those 401 suspected cases, about 129 of them have actually been tested, were tested, or had the privilege of being tested. Some of them, so for cholera, sometimes it could be asymptomatic. For some people, they might be infected, have diarrhea one day, they go back home. But they were a suspected case, but they've gone back home. So cases that made it to the lab that were tested are like 129. And out of this 129, 35 of them were actually confirmed to have vibrio cholera. It was isolated, so they have cholera.
Is it possible that from the remaining numbers of that 401, there's others that are positive?
It's unlikely, because all the ones that
Because you say you've tested only 129.
Yes, so all the ones that came to the health facilities that had, before they were discharged, because another thing that is going on is that a lot of people, due to health-seeking behavior, sometimes they present at the pharmacies and they use antibiotics. Any small thing, they use antibiotics, which is an abuse of medication. So by the time you use these antibiotics, it masks the picture. So we're not able to get a true picture of what is going on. So the ones that we were able to catch before medications have started, because they will give us a true reflection of the results we're expecting, are the ones that were sent to the lab. And now out of them, it's the 129, and then 35 have been confirmed. So the others, either there was no indication for testing anymore, or the symptoms resolved on their own and they were actually discharged to go home.
All right, let's talk about how cholera spreads, because people might hear that someone maybe has tested positive for cholera and now starts avoiding them. Is that a time to avoid people? How quickly does it spread?
Okay, so cholera is transmitted through the fecal-oral routes. And what that basically means is that there has to be a connection somehow between feces and then getting ingested. But obviously, we know that people don't ingest feces. So there are mediums through which that feces can actually get into the human body. We usually use the fecal pathway to describe that, and it includes 4 or 5 Fs. So from the fecal matter, which is the feces now, it can either go through food that we have talked about, food being contaminated. Food is the contamination where it gets contaminated. But for it to get to food, from the fingers, like if you don't wash your hands properly, I use the toilet, I don't wash my hands, I eat, that's my fingers. The other one is fluid. Water bodies can get contaminated by fecal matter. That's why we are discouraging open defecation or having sewage water, wastewater close to the primary source of drinking water. And then, so these are ways in which from fecal, it can get to food, and from food, you ingest the food, and it gets to human. So that's the mode of transmission.
From
it's
human
not
to human?
No, it's not infectious. However, in hospital settings, the loose stool from the patient with cholera, so caregivers or healthcare providers treating a cholera patient can have contact with their body fluid, the loose stool, and that can also be a source of infection to them. So we have infection prevention control measures at our hospitals, health centers, to remind healthcare providers to always ensure they use their gloves, use everything they need to do to protect themselves and ensure that they also don't get infected from a patient. All
right. Is there a way to tell what exactly is the cause of a cholera outbreak? Like in every... Like from what we're seeing in Lagos now, can you tell whether it is, it caused by open defecation or it is caused by failure to wash, hands in a restaurant? Is there a way that we can tell where the very first case in Lagos started from? Yes,
so we've actually been able to cone it down a bit. Usually, cholera is not really something we should be having anymore in this day and age. So anytime we have such an infection like cholera, it just shows a breakdown in our wash system. That's our water, sanitation, and hygiene. So it's mainly an environmental problem. So it's either that our water has been contaminated, our wastewater is not being channeled properly to the right way it should be channeled. So we've been able to find out, so immediately this happened, a public health emergency operating center was constituted, and it comprised of people from the Ministry of Environment, Lagos State Environmental Protection Agency, even our Environmental Health Directorate at the Ministry of Health. So they went out to the field, especially Lagos Island, where we had almost 100 cases in 2 days. They started testing their water bodies to try to find out if they were contaminated. And we started getting the results, and it has shown that we have some contaminated water sources in Lagos Island, and immediately they've cordoned off such water supply source. They've given them alternatives, and they've also treated with chlorine. So that's ongoing, and I'm sure that as a fallout of this outbreak, we're going to be they've been doing it before, but it's going to be more intense to continue testing our water bodies to make sure that there's no contamination.
Is it possible to be specific where in Lagos Island?
Okay, unfortunately, I won't be able to give that information. However, once they finish compiling the results, the press release will be made out to the public. But be rest assured that instant measures have been taken. They've cordoned off the area. They've disinfected that water body. They've given the people their alternative water supply, because it just takes a few days for you to, for example, if it's a well that has been found to be contaminated and you do your chlorination there, in a short while, the water is safe for everybody to use.
Yeah, but can you tell, apologies, but can you tell, because you're talking about water bodies now, can you tell if this is born out of open defecation or some other? Oh, sure. Most likely it's open defecation, because remember I said it's fecal-oral, so there has to be fecal matter that has combined or mixed with water. And does that concern you? Yes, definitely. So that's why we have our developmental partners on board. We have UNICEF, who is actually big on WASH. They've come up with WASH strategies. We have all the relevant agencies and ministries in Lagos State that should be channeling wastewater properly. So they are doing their assessments, they are doing risk assessments, they are carrying out so many things that are going on at this point in time. It's actually really, we celebrate, we have days where we look at toilets, all those things. So yes, all those environmental matters. So yes, we are not quite there yet as a nation, and because we're almost reaching 30 million in Lagos, so Lagos is overpopulated. We have slum areas, so things like this would keep happening. However, we have to take all our environmental measures more seriously and then come up with drastic measures to ensure that we have clean water supply, and then we have channels where our wastewater is being evacuated from.
What actually gives me concern is, cholera is often referred to as, like we mentioned earlier, it's a disease of poverty. It's a disease that reflects how poor a nation or a people are. People don't have access to clean water. They don't have access to toilets. Like, it's a shame that we still have conversations about open defecation in 2024, and that shows that there aren't toilets. So in this current climate where life has been very, very hard, people are talking about the cost of inflation, yet we're talking, on the other hand, discouraging people from eating out, telling them to be properly hygienic. There are people who do not have the luxury of not eating out, of not eating by the roadside. should we be worried? And what would you say the government is doing to be able to help people like that who are not doing this because they want to, but they don't have any other alternatives? They don't have toilets, they don't have access to potable water, they don't even have access to food. So whatever food they can get, they'd have to make do with that.
Okay, so our health education is actually, and health awareness is delving really deep down to communities, to this kind of people that you're actually describing. So the prevention of cholera basically does not necessarily have to do with how much I have. There are basic hygiene measures. For example, if I have no choice and I have to buy food outside, if I'm buying fruits and all I have to do is ensure that I wash my fruits properly. So a lot of people are fond of maybe, I go to the market, I see carrots, I buy carrots, and immediately it's going into my mouth.
But the water that they
apple.
use to wash it, even some of us who live on the island, we still have to buy water in bags to be able to ensure that we have access to clean water. So some don't even have that water, and they can't even have access to buy the water because they don't even have money.
Exactly. I totally understand you, which is why another strategy or preventive measure, which you can use to safeguard yourself, is ensure that whatever water you're using, you boil it, because boiling has been found to kill the bacteria, viral cholera. So boiling for just 1 minute, so you don't even have to complain about, oh my gas or this. Once you boil your water, you have already purified it to a reasonable extent. Then we also have these chlorine tablets that are widely available. I think they go for 20 naira a tablet, and one tablet can purify almost 25 liters of water. There was a time it was very popular. There was a common one that was water guard. That's what it's called. So in areas where I know that I'm suspecting my water, because we can't wait for LASEPA to test all the water bodies before you know if your water is contaminated or not. But people can tell sometimes by the taste of water. So merely using your chlorine tablet can purify your water for a whole household. So there are some simple measures. There's nothing highfalutin about trying to ensure that you protect yourself from some of those waterborne illnesses.
All
right. It's a lot of conversations we're having this morning, but we thank you very much, Dr. Oluwatoni Adeyemi, for being here with us. And we look forward to the day when conversations about cholera in Lagos, in Nigeria, become a thing of the past.
Looking forward to that as well.